when we're talking about shoulder instability surgery, you can consider two operations. There is the labral repair, which is the one that probably in my hands I do most often because it restores the anatomy, it's keyhole, it's faster. The disadvantage is that it takes longer to recover back to the point where you're playing sport. It takes 5 or 6 months. Latarjet surgery, on the other hand, is a more invasive procedure. It involves dividing bone. It's not anatomical. It's a non-anatomical reconstruction of the shoulder, but the advantage of that is that it has a lower dislocation rate after surgery and is suitable more for the person who wants a more radical procedure with a better result. That would be the case in all contact athletes. For example, if you were on a very high salary as an NRL player, you might want one operation that gets you back on the field in 10 weeks rather than a lesser surgery which gets you back on the field in 6 months, which is what most people would choose to do. In other words, I would think, certainly in my hands, the Latarjet is reserved only for a minority of people, and the majority will go for the labral repair given the choice. But that can be discussed. Everyone's entitled to their own choice. I would offer you anything that you want once you understand the difference between the two.